What's up, everybody? Welcome back to another video.
What up? I'm not sure if you can tell by my face. I don't know if it's gone down enough yet, but I had the baby.
Yay!
So she's about a month old now. She was born on November 12th, early in the morning.
Yep, 9:33 to be exact. Or was it 9:38?
It was 9:33. She was 7 pounds and 4 ounces,
and
now she's well over 9 pounds in only a few weeks. Jeez.
Yep,
she's eating.
Yeah.
So here's a picture of her.
Isn't she just adorable? I love my baby. Yeah.
That's the newest addition. Averi, yeah, her name's Averi with an I.
With an I, yeah.
And yeah, so how has it been? So now we have 2 kids in dental school. Okay, first we had 1, we were dealing with that, but now we have 2. I took off the last week of my while I was still pregnant. I took that week off, and then I've been off ever since. So it's almost 6, close to 7 weeks that I've been off now. However, the school has been working with me, and they allowed me to come in just so I can see my removable denture patient, because we have to do so many of those, and I wanted to get it done this semester. So they've been allowing me to go in whenever I could to see that patient only. Our family came into town. Amazing. Such big help.
Such a big help.
So yeah, they were able to watch Averi while I went to school, because obviously David was still in school, and so we needed someone to watch Averi. There's been other times where David has taken off from clinic to watch the baby because I wanted to go and see my patient. So we did that. Yeah, that's just how we've been making it work.
I mean, just a quick note on like UDM and our school. Like, I freaking love our school in terms of just them being understanding and working with us, like this whole process, like, because we've been pregnant twice in dental school. Kalia, who you can see right here behind me, she's knocked out in her car seat.
Averi's over there,
and Averi's sleep in her car seat. But we had Kalia first, obviously, and we had her during our second year. And just with both pregnancies, they have been just very understanding and supportive, and have been working with Jessica in terms of allowing her to finish things at a later time, if need be, or allowing her to come in and complete things if she wanted to. So they've just been very supportive, so we can't thank them enough. And I'm not sure if other schools are that supportive, but definitely here at UDM they support their students, and that's one thing that I can definitely appreciate. So with that being said, yeah, it's been a journey for the past 4 weeks. It's been fun nevertheless. But yeah, so I'm back in school. I think I took off the entire week. She was born on a Monday, and I think I took off that entire week, and then I went back to school the following week. And I've been taking off a couple of days here and there. But yeah, I mean, we've just kind of like picked up where we left off. Fortunately for Jessica, she completed a lot of her requirements earlier before she had Averi. So that's good. So she can take off the time, because I know a lot of you are probably thinking, oh, with her taking off 6 weeks, is that going to delay her graduating on time? And at this point, we don't expect her to be delayed in graduation. We expect her to graduate on time.
Yep.
Yeah.
I'm all pretty much caught up where I should be with my requirements.
Yeah.
As far as final exams, because like I said, I'm taking off all this time. How's final exams going to work? Well, they're allowing me to take it next semester when we start back in January. So I'll probably just have an eye on my transcript for now for these classes, and then January I take the final exams, and then they'll give me my grade, which is good because I don't have to wait a whole year until the next class is at this point, and have to join that class. So in clinic, you have to get so many CPUs, and CPUs stand for what? clinical performance
unit or procedural unit.
Maybe, okay.
Yeah.
Okay, so you have to get so many CPUs, and basically you get a CPU for all the procedures that you do in clinic. So there was a minimum requirement of CPUs that we had to get for this semester, and I am 18 shy. Literally just 18 shy. I was so close.
Close.
But of course, with me taking off 6-7 weeks, it's expected that, I didn't do anything, or I didn't do much in all that time. So I wasn't able to get the CPUs that I would get had I been there the whole time. So with me being 18 CPUs shy, I'll just have to make up those CPUs within the next semester as well.
Yeah.
So if you're wondering about that, like staying on top of that while you're in dental school, just hope that your school is supportive and that they work with you, because UDM has been great working with me.
They really have. I mean, we couldn't ask for anything better, really. It's been a blast. I honestly haven't really noticed much of a difference in terms of like it being more hectic or more difficult, having 2 children. I'm sure that, as Averi, as the both of them get older, things will kind of pick up. But now, Averi, she's a newborn, so she's still in that stage where she's just really just sleeping, eating, pooping, So, not to downplay it. I don't really think it's had that huge of an impact in terms of like, oh, I'm so stressed out, I'm so overwhelmed. It's really just a blessing, and we're just happy that she was born healthy, and
Yeah.
We have the mindset, we don't really stress about things that we can't control, so we just kind of take it day by day.
So I am back to breastfeeding now, because I did stop with Kalia when she was a little over a year old.
Yeah.
So now I'm back, and it's been okay. Like I said, I had to go to clinic a few times to see a patient. So I would just pump right before I saw my patient, and then right after I saw my patient. That's just how you would have to make it work if you want to breastfeed while in dental school.
She's really adamant about breastfeeding Averi for as long as she breastfed Kalia.
Mm-hmm.
And it's tough in terms of, especially it'll be even tougher when she gets back to school. But, just like she made it work with Kalia, she'll find a way, I'm sure, to make it work for Averi, because, being in clinic, you have to find times between patients. And then sometimes, when you're dealing with patients, you're never on an exact schedule. You think this appointment is going to last a couple of hours or X amount of time, but something inevitably happens where you're, running over or something happens. So yeah, but I'm pretty sure she'll find a way to get it done. All of our experiences and our journey is like a testament to you guys that if you want something bad enough, you can do it. You can make it happen. Obviously, you need to put your priorities in order and make sure things are, in its proper place. But if you really, really want something, no matter what it is, you want to start a family in dental school, you want to attend dental school. A lot of you are watching our videos because you want to get into dental school. And, that's the theme of our channel, that, persevere, do what you have to do, prepare, and you'll be successful. It may not be the first time, but you'll be successful, So I think that's the biggest takeaway from all of this, right?
Yeah. Yeah, I wish I had footage of the laboring process, but
yeah. So I was gonna record the laboring process, but she was just like, "No, I don't want to." I was like, "It'd be cool."
I know, now I regret it.
Yeah.
So for the next baby, if there's a next baby, I don't know. Then we might.
Yeah. It was fun. The labor was fun. We didn't really talk much about the labor, so
it was fun for him, of course.
Well, yeah. It was a beautiful process. So quickly, Averi was 10 days overdue.
Oh yeah.
Right? She was 10 days overdue. Everyone at school, all of our family and friends, were like, oh, you know, she's probably gonna come like a little bit later because her expected due date was like November 2nd.
Yeah, and she came
and
on
we were
12.
like, no, she's gonna be like right on time. If anything, maybe 2 or 3 days.
I just
overdue.
knew she was
Like,
coming.
she
November
just knew
2nd.
it. And so like the midwives at the OB office that we were going to, they typically when you you know, are far along in your pregnancy, they schedule your induction just in case you end up, you know, going far enough to need it. And Jessica was like, no, we are not going to need it. And so we ended up going to our scheduled induction.
Right.
And it was a 9 o'clock on a Sunday night. We went in for the induction, and Jessica, at this point, I think she was kind of indifferent. Obviously, she didn't want to be induced because it's like artificial oxytocin is Pitocin that they give you to kickstart your body to go into labor. And obviously anything that they have to give you that's not natural is going to make the labor pains a lot more intense and exaggerated. At least that's what she says. So she did not want
it does, because I had to get Pitocin with Kalia, and it was
so she did not want to do that. So we went in, and thankfully she didn't have to be induced. Her body went into labor naturally. And I think you labored for about 12 hours.
Maybe 12 hours, yeah.
Yeah, about 12 hours. And she was, like I said, we went in Sunday night, and Averi was born at 9:33 on that Monday morning, November 12th.
With Kalia, I labored for 2 days almost.
Yeah.
Pretty much 2 days.
That was rough.
But with Averi, like you said, it was 12 hours of laboring, just, you know, trying to get her ready. And then once I started pushing, I pushed 3 times maybe, and she came.
3 times that she came.
It was all natural. No epidural, no pain medication. Even though I wanted it, it was at the last minute. I was like, okay, just give me... obviously I didn't want an epidural because it was way last minute, but it was what was it?
Stadol.
I wanted Stadol. I was like, oh, just give me Stadol. Just give me Stadol right now.
I felt so bad for her. Because I had to leave the hospital to take Kalia because our friend, shout out to Kiani, our classmate, she watched Kalia for us the night prior, that Sunday night for us, because we knew that it would be a lot, you know, and we don't have family here. So she was gracious enough to watch Kalia for us. And then so that following morning, Kiani had to go to school, obviously, so she dropped Kalia off to the hospital. And I was battling with myself. I was like, should I just bring Kalia and keep her here in the labor and delivery room with us? I knew she would, you know, be crying and want to get in the bed with Jessica. Or should I take her to daycare? Obviously, I knew that would be the best option. But her daycare was like 30 minutes away. And then obviously I would have to drive 30 minutes back. So that was like an hour. And at that point, I think Jessica was like 7 or 8 centimeters.
What time was it that you left?
I left like at
was it
7:30, something like that.
So 2 hours before Averi came.
Yeah, so 2 hours before. So I was like, okay, I'm just gonna go for it, you know, because I knew that would be the best thing. So I called Jessica. I was like, stay on the phone with me the entire time, and you know, worst case scenario, if things start, you know, changing and she starts to go into labor a lot quicker, you know, then I'll just turn around. So long story short, I dropped Kalia off, and then I was on my way back. I made it all the way back to the hospital, and I think about 10 minutes after I made it back to the hospital, you know, they went in, they manually broke her water, and like she said, she pushed 3 times, but she caught, like, while I was on the phone heading back, she was like, I can't take it anymore, the pain. She was like, I think I just want pain medication.
I tried so hard not to get it. I mean, I didn't get it, but it was by default.
And so I was like, well, I mean, that's not going to make you any less of a
I know,
mom,
but
you
I
know,
felt like I was giving up on what I wanted.
So I was like, yeah, just get the pain medication, you know, that's fine. And then, so I don't know if she was like looking to me for like permission or something. So
yeah, I kind of wanted him to say no, but he just was like, get it.
Yeah, and so she asked the nurse or the midwife, like, can I get pain meds? And she was like, no, like, you're too far along.
Yeah, they said they didn't want to make the baby sleepy because it would make me tired, which is what I wanted, because I hadn't slept all night. Like, I was so exhausted. And so I just wanted something to help me go to sleep. And that's what I wanted. She was like, oh, it'll make you tired and it'll also make the baby tired. So that's why we don't want to give it to you at this point.
And that's when they went ahead, since I had made it back, because I think she was waiting to break her water
Yep.
But, until I arrived.
Yep.
And
Because
so
as
when
soon
I
as
got
they
there,
broke the water,
Yep.
that was it. I was ready to push. The midwife left the
yeah,
room.
like everybody was out of the room.
It was just me and David. I was like, okay, I need to push.
was like, "I gotta
Nobody's in
push."
there. And I just started pushing.
And I guess the screams like alerted.
Yeah,
them.
and then they came
in.
back.
Yeah,
Pushed a
so
couple more
it was
times,
great.
and Avery
I cried.
came.
Yeah.
Oh yeah! As soon as
I
he saw her
cried.
head, he started crying, and that made me so sad.
It was the most beautiful thing. Like,
It was a beautiful journey.
Yeah,
it
it's
was.
just, I tell everybody, like, everybody's like, oh, how was it? I'm like, you think you love your little brothers or like, your nieces and nephews, like you think you love them, but until you like have your own children, it's a completely
like
different love. Like if you think you love those kids, like the love that you'll have for your own is like a completely different experience.
It's indescribable.
I almost tell like women, like it's probably even hiding for you guys because you're like carrying this baby for 10 months, forming a bond with this child, and then to birth this child is just really an amazing journey. And we're blessed to have two healthy, beautiful girls. And just to start our family. So we're excited. Yeah. And we're glad that we could share it with you guys.
Yep. So thank you so much for listening to our story, for watching this video, for meeting Averi.
Yeah.
Hopefully we'll post more videos about how it's going, having both of them, and us both being back full-time in clinic. But yeah, until then, take care and thank you.
Deuces. We're going to get in here and get this Christmas tree.
Bye.
Yeah, bye.
Happy holidays.
Yeah. Building a wall. Building a wall.